Dr. Pierre Broussard performs more than 200 of these sex reassignment surgeries every year on both men and women.
The procedure, it's more or less like a symphony. Every part of it has to come in a certain sequence. If you don't do that, then you're in trouble.
In this procedure, known as a vaginoplasty, the testicles and most of the penis are removed and shaped into female genitals. A vagina is then created between the bladder and the rectum. The resulting female sex organ is as sensitive as a genetic woman's. But as with any procedure, there are risks.
Other risks are swelling that lasts long, difficult healing of some incisions. Some of the skin outside on the external genital is lost because of lack of circulation, but this is a rare complication. Of course, the worst one is death, related to a complication like a pulmonary embolism. The incidence is not higher than any other procedure.
The other risk is that patients will come to regret their decision, and some medical professionals still question the ethical validity of sex reassignment surgery.
Should we perform surgery on anorexics so that they don't absorb any food? They want to be thin. Why don't doctors do that? Because it hurts them, obviously.
In some cases, patients may be suffering from psychological or emotional problems which surgery won't resolve. But when the diagnosis is correct and the mind's identity truly doesn't fit the body, surgery can be the best option.
I feel that trans people are fortunate that we have a medical intervention for this condition. This is not like being too short or being too tall. It's elemental. It's who I am. The basic identity issue is I'm a human being, and the next basic one is I'm a man or a woman. If that basic sense doesn't match your body, we have something that we can do to help people have the appropriate physiology.
Confirmed. It's a girl.
Less than 3 hours ago, Angela entered the surgery room with her male genitals intact. Now she is being wheeled out with no external trace of her manhood left. Her new body is bound to change her relationship with Johnny. But will it be for better or for worse?
I slept until 2 o'clock in the morning and then I was wide awake. My new princess. Isn't that sweet?
It's the morning after Angela's sex reassignment surgery. She is now as close to being a genetic female as is medically possible.
I'm really glad it's over, and I've heard other people say after the surgery that they feel really calm and complete, and I thought, yeah, that's kind of hokey. That's the way I feel.
Kind of hokey.
Yeah, kind of hokey.
The night before, as Johnny looked on, Dr. Pierre Broussard operated on Angela's male genitals to make them look like a woman's.
I visualized Angela after the change for quite a while before we came up here to make certain that I was at peace with it, and I'm at peace with it. During the surgery, I just was so interested in what all they were doing that it almost ceased to be Angela that was there. In a lot of ways, it was a delight to be able to know how that came together. I guess the more you know, the better you feel about things.
A week later, Angela is recovering at the hospital's residence for post-operative patients outside Montreal.
Each day she seems to be more whole, and she's become even more so now. And there's a quiet happiness involved there, I think, and that means a lot to me.
I feel like my body finally matches my internal image of myself. I've reached the end of my journey towards becoming a woman. I think I started life as a male with a female brain, and I think I'm making my physical appearance now correspond to my female brain. I finally got my act together, and I'm finally who I should be.